Good morning. I'm Representative Dave Pinto, the chair of the House Early Childhood Finance and Policy Committee, and I'm calling this meeting of the committee to order pursuant to House Rule 10.01, which allows for virtual hearings of this type. Welcome to members of the public joining us. I want to direct your attention to our committee website where you'll find an agenda and meeting materials. I know there's a number of letters regarding the bills we'll be hearing today, et cetera. And so I think with that, Mr. Dozen, if you could please kick us off by calling the roll.
Representative Pinto, Chair.
Present.
Representative Pryor, Vice Chair.
Present.
Lead Franzen.
Present.
Representative Bennett is excused and will be joining us later. Representative Bolden.
Present.
Representative Daniels.
Present.
Representative Davnie.
Davnie, present.
Representative Damas.
Present.
Representative Jurgens.
Jurgens, present.
Representative Cotiza-Watoon.
Cotiza-Watoon, present.
Representative Morrison is excused and will be joining later. Representative Wozlowick.
Wozlowick, present.
And Representative Wolgamott.
Representative Wolgamott, present.
We have a quorum. Thank you.
Thank you, Mr. Dosland, and thanks all. Representative Pryor, if you could move approval of our minutes from March 22nd.
So moved, Mr. Chair.
Thank you, Madam Vice Chair. So any additions or corrections, members, to those minutes? So hearing none, all in favor of approval of those minutes, please say aye.
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 Any opposed? Okay, so the motion passes and our minutes from March 22nd are approved. And so members, the plan today is we have two bills. We have one bill officially in front of us, another bill that we're hearing informationally only because we had trouble getting the timing right to be able to hear it. But in both cases, the plan is to lay them over. And these are the budget bills from the administration, from our Department of Education, Department of Human Services, and delighted to have folks from those agencies with us. Although we have one bill at the very end that we're going to get to as well from Representative Lillie on the Children's Museum. And so, I guess I'll just make this point right now that I think these are really terrific proposals, and I would expect that in these next 2 weeks, as we are considering budget proposals for our committee, and as I'm rolling out my proposals, I expect to draw significantly from these proposals from the administration. So really want to encourage every member of this committee to kind of dive into the details. We heard presentations on these previously, right towards the beginning of our of the session, and now's the chance to get into the details. So I'm handing things over to the Vice Chair, Representative Pryor, to take it over from here.
Well, thank you, Mr. Chair. Chair Pinto, would you like to move House File 4228 to be laid over for possible inclusion in a committee omnibus bill?
So moved, Madam Vice Chair.
All right, thank you, Mr. Chair. Chair Pinto, please explain your bill.
Thank you, Madam Chair. And for that, I'm actually just going to kick it right over. I think we have Commissioner Mueller. I'm delighted to have her here to share thoughts. And so with your permission, Madam Chair, we'll just dive right into that.
All right, Commissioner Mueller.
Thank you. Good morning, Madam Vice Chair and Chair Pinto and committee members. My name is Heather Mueller, and I have the honor of serving as Minnesota's Commissioner of Education. Thank you for authoring, Chair Pinto, House File 4228 that contains the governor's early childhood priorities in this 2022 supplemental budget. Last month, we provided you with a high-level overview of our bill, and we appreciate the opportunity to walk through those details with you this morning. I know that I had said this the last time that I was in this committee, but it is worth repeating. Budgets reflect the values of the people who create them, and I believe that this budget reflects how we believe in the mission of this committee's work and believe in our youngest learners. The years that a child spends before they enter the kindergarten classroom are full of learning, and their brains are not only ready to learn, but they are also desperate to learn. You've learned and heard a breadth of research in committee that shows how critically important the early years are to setting up a child for positive academic, social, emotional, and behavioral outcomes later. This is at the forefront of our minds at the department when we work with our littlest learners, because we have the opportunity to be proactive and set them up for success. These investments truly put our money where our values are by taking action to strengthen and provide programs and activities proven to work, while streamlining delivery of these programs and ensuring that families have choice and flexibility to meet their unique needs. I'd like to highlight some of the important proposals included in this bill. It creates a statewide mixed delivery pre-kindergarten program centered on best practices that will provide access to over 23,000 four-year-olds. It provides a robust investment in early learning scholarships that will help over 10,000 children statewide access high-quality early learning opportunities. It assures a crucial set aside for our tribal Head Start programs that demonstrates our commitment to our youngest American Indian learners and the sustainabilities of the programs that serve them. It establishes a specific strand of Grow Your Own grants that are targeted at not only developing and growing the early childhood education workforce, but also ensuring that the workforce accurately represents our state's diverse population. This means that the people already providing quality care to our children in child care centers, early learning programs, Head Start, and others will have the opportunity to continue their education and further their careers. And it invests in mental health services by expanding early childhood social workers, including infant and early childhood mental health consultation in schools, and providing grants to create early childhood mental health systems of care in our schools. When families have the access and the resources they need, our children thrive. I believe that we have a shared goal, and I believe that this budget gives us the opportunity to fundamentally shift the trajectories of Minnesota's students for the better, which actually shifts the trajectory of Minnesota for the better. With that, I'm going to hand it over to my colleague, Adosh Uni, to provide the committee with a will walkthrough.
Thank you, Commissioner Mueller. We'll turn it over to you, Mr. Uni.
Madam Chair, committee members, thank you. My name is Adosh Uni, and I am the Director of Government Relations with the Minnesota Department of Education. Thank you for the opportunity to do a section-by-section walkthrough of HF 4228. Section 1 details a set aside of the Head Start appropriation to be designated for tribal Head Start programs and sets that at a 10.72% set aside. Additionally, it allows for the expanded use of funds of Head Start funds to support expanded uses like infrastructure and operations. Section 2 clarifies that eligible 4-year-olds may enroll in the public pre-kindergarten programs. Section 3 sets the minimum of hours of instruction for a public pre-kindergarten student to receive. Section 4 makes optional the in-person early childhood screening if a parent or child is immunocompromised or has other health concerns, including the ongoing pandemic, and the screening can be completed virtually. Section 5 increases the per pupil amount of developmental screening aid by age group. Section 6 establishes Grow Your Own early childhood educators grant programs to develop an early childhood education workforce that more accurately represents the state's diverse population. Eligible applicants can be licensed family child care, licensed center-based child care, district or charter early learning programs, Head Start, higher ed institutions, or other community partnership non-governmental organizations. Sections 7 through 8 add adults who provide child care and caregivers to the early childhood family education statute, so they may also receive services. Section 9 strikes obsolete language on the Council of Early Learning and updates their actual responsibilities in accordance with 2021 laws. Section 10 is on the public pre-K program for eligible 4-year-old children. This establishes full-day state-funded pre-kindergarten for the most underserved 4-year-old children using a mixed delivery model comprised of school-based, Head Start, and community-based licensed center and family child care programs. Programs will assess each child's progress towards standards, provide 850 hours of instruction, provide salaries equivalent to district or charter staff, employ a lead teacher for each classroom with at least a bachelor's no later than July 2028, and a coordination with mixed delivery partners. As mentioned, the programs must submit a mixed delivery plan to MDE annually. Of the new seats, 30% will be allocated to licensed center and family child care, 30% to Head Start, and 40% to school-based programs. Licensed center and family care and Head Start are being allocated $11,000 per seat for approximately 8,600 seats across program types. School-based programs will be allocated seats through general education funding for eligible 4-year-olds, and variation in the distribution of seats to meet the local need can be approved by the commissioner. Eligible children qualify for free and reduced price lunch are English language learners, American Indian students, students experiencing homelessness, are receiving special education services, are identified as having a risk factor under developmental screening, are in foster care, have a parent who is a seasonal laborer or migrant, or a parent who is incarcerated. A sliding fee will be allowed for non-eligible students, as well as for all students above 850 hours for before and after school or during the summer months. That concludes section 10. On section 11, this expands the eligibility age from for scholarships from 3 to 4 for early learning scholarships, pardon me, from 3 to 4 to birth to 4. This section 12 for scholarships adds children not yet 4 and those currently in need of child protective services and children with a currently incarcerated parent to the prioritization list for early learning scholarships. Section 13 clarifies that public pre-kindergarten students generate 1.0 pupil units if they receive the minimum instructional hours. Section 14 strikes a line of statute relating to the calculation of compensation revenue based on voluntary pre-kindergarten numbers, which would not be applicable when the full public pre-kindergarten program is established. Section 15 makes clear that the public pre-kindergarten pupils may not be included in calculating declining enrollment in the first year of the program. Section 16 clarifies that school districts and charter schools are eligible for children's mental health grants. Section 17 sets the early learning scholarship appropriation for fiscal 23 at $122,065,000. It also makes clear that funds may be allocated to Head Start and licensed childcare providers to implement the voluntary pre-kindergarten transition year. Section 18 increases the appropriation for early childhood family education. Section 19 sets the developmental screening aid appropriation. Section 20 establishes 2023 as a possible transition year to give existing voluntary pre-kindergarten, School Readiness Plus, and Early Learning Scholarship Pathway 2 programs a year to transition to the new public pre-kindergarten program for eligible 4-year-olds. And Section 21, Madam Chair, which is the last section, sets the appropriation. Subdivision 1 clarifies the funds that are appropriated to MDE. Subdivision 2 is an appropriation to mental health services and early childhood scholarship, social workers for grants to strengthen early childhood programs, access to social workers. Subdivision 3 is the appropriation for the public pre-kindergarten program through mixed delivery. And final subdivision 4 is funding for infant and childhood mental health consultation in schools for grants to create an early childhood mental health system of care in schools. And Madam Chair, committee members, that concludes the walkthrough of the bill.
Thank you. Thank you, Mr. Uni, for that walkthrough. We do have public testifiers to further dig into this bill and understand it. So unless there's a clarifying question at this point from members, we'll go on to public testimony. So first up, I have Safia Khan. Could you identify yourself for the record? And please proceed with your testimony.
Good morning, Chair and members of the committee. My name is Safia Khan, and I'm an Assistant Commissioner and Chief of Staff for the Minnesota Department of Corrections. I'm here today to lend the department's support for some mighty provisions in House File 4228 that include children who have a parent incarcerated as a priority category for some early childhood programs, including early learning scholarships, and these provisions also increase the state's investments into these programs. In the spirit of quantifying the impact of these provisions, I just wanted to share some numbers with you that are based on pre-pandemic research done by Dr. Schlafer at the University of Minnesota, along with DOC's research team. What we have found is that almost 70% of those incarcerated in our state prisons have minor children in the community, and well over half of these parents were living with those children before their arrest. Chair members, on any given day in Minnesota, more than 16,000 children under the age of 18 have a parent in one of our prisons, and that number is about 10,000 for our county jail. And breaking these numbers down even more, between 30 to 40% of these children are between the ages of 0 to 5. So as you can imagine, the impact of the parents' incarceration is devastating on this age group. In another study that was done in Minnesota, we found that 60% of caregivers reported that they were employed at the time they started caring for these children, return once their parent became incarcerated. However, more than 1/3 of the caregivers reported that since the child came home, someone in that home had to quit a job, not take a job, or greatly change their job because of problems with childcare. This is also consistent with what we at the DOC hear from families in the community. So chair and members, expanding these priority categories and increasing these investments to include children of incarcerated parents will greatly help the littlest Minnesotans who are impacted by a parent's incarceration as well as their caregivers. It will help the caregivers keep their jobs. It will help the children who are often marginalized to access quality education during their formative years of their life, and it will allow for a better tomorrow in Minnesota. So on behalf of Commissioner Schnell, I want to thank our colleagues at the Department of Education, as well as Chair Pinto for authoring these provisions. Thank you again for allowing me to speak and support these additions today.
Thank you, Ms. Khan. Next up is Bree Ostoff. Could you please identify yourself for the record and proceed with your testimony?
Thank you, Chair and committee members. My name is Bree Ossoff, and I serve as the Director of Community Education for the Farmington Area School District. Today, I represent the Minnesota Community Education Association in sharing our support for House File 4228. We have some questions about the logistics and plan to continue to talk through logistics with MDE. There's incredible value in streamlining the funding process and access to quality pre-kindergarten programs for eligible 4-year-old children. Currently, there are 3 buckets of funding for these students: voluntary pre-K or VPK, school readiness, and pathways 2, each having their own guidelines and stipulations, but successfully reaching more students when braided together. This streamlined model also allows for more collaboration between families and community partners. The increase in state aid for each developmental screening performed as a child enters kindergarten is needed to meet the increased costs of staffing. These screenings are so important to identify the potential health and developmental delays of children as young as 3 years old. These screenings allow school districts the opportunity to partner with parents to assess their child's growth and development to determine if children qualify for additional early childhood services, such as early childhood special education. If left unidentified, these delays can result in a gap in kindergarten readiness. Grants to grow your own early childhood educator and early childhood family education licensure programs are necessary to develop a large enough workforce to meet the standards expected for quality early childhood programs. Currently, the supply does not meet the demand for these jobs, and we need to support those wanting a career, building the foundations for our youngest learners. Lastly, giving school districts and charter schools access to grants that support services for mental health and our students opens doors to accessibility and breaks down barriers of inequality. Having these services in schools creates a collaborative approach in supporting the whole child in their development. In summary, the Minnesota Community Education Association supports House File 4228 and sees it as a way to grow the capacity and quality of programming for our youngest learners.
All right. Thank you. Thank you, Ms. Ostoff. And I will mention to our next testifiers is we do have a tight timeline today, and I appreciate it if you can keep your remarks to 2 minutes as we go through our testimony. All right, next up is we have Sandy Samara, Director of Early Head Start and Head Start, Families First of Minnesota. So Ms. Samara, if you could identify yourself for the record and make your brief remarks. Thank you.
Certainly. Good morning, Madam Vice Chair, Chair Pinto, and committee members. My name is Sandy Simar. I'm the Head Start and Early Head Start Director at Families First in Rochester, Minnesota. Thank you for the opportunity to speak on behalf of House File 4228. I'm just going to speak to a couple of the provisions of the bill, although all the provisions are really going to be beneficial to early childhood across our state. I'm particularly excited about the Grow Your Own Early Childhood Educator programs. As other testifiers spoke to, it's really important that we address staff shortages in early childhood. That's one point. But the other point is that we really need to have more intentional efforts to really diversify the early childhood workforce. For the parents that we serve in our program, we're over 50% of our families. English is not their home language. It's so important for them to be able to have clear pathways if they desire to work in early childhood settings. So it meets families' goals and it meets children's goals, and that it really, in turn, really leads to improved outcomes for children as our workforce is diversified. And it's what I've seen over the years. It's an unbelievable, powerful model to have children see their parents obtain higher educational credentials, and it really supports their ongoing growth in that area. Secondly, I really want to say that it's really a great effort to add additional funding to serve more 4-year-olds in pre-kindergarten slots across our state. That will be a great benefit for our children, for many of them have not had consistent classroom or early childhood experiences prior to entering kindergarten. And for the Head Start community, that would result in about 1,600 to 1,800 additional 4-year-olds that'd be served in a comprehensive child and family development
Ms. Simar,
program.
we
Yes.
are at time right now
Okay.
with 2 minutes and so if you could wrap it up. Appreciate
Okay, I will. Thank you. And I just want to say I'm also in support of the early childhood mental health support. Thank you.
Thank you, Ms. Simar. Next up is Vanessa Good Thunder, Director, Early Head Start and Head Start, Lower Sioux Indian Community. Ms. Good Thunder, can you please identify yourself for the records and begin with your testimony?
Absolutely. Homi da kuyapi Vanessa Guthaner makiapi Dakota yasnas nawi demi chanshapi wa kayanja oayawa oti oitancha hemachaye. Hello, everybody, Madam Chair, committee members. Thank you for letting me testify. My name is Vanessa Guthander. My Dakota name is Nasnawi. I come from where they paint the trees red, which is the Lower Sioux Indian Community in Southwest Minnesota. So to the left, you see corn, to the right, you see some more corn. I'm here to talk about House File 4228 in support of the Tribal Head Start formula set aside of 10.72% of the total Head Start annual allocation for Tribal Head Start programs. This will just continue to increase stable funding for us, and I'll continue with, I'll get to that part, and also about the state head funding allocation usage language to allow costs associated with program operations, infrastructure, or reconfiguration to serve birth to age 5 in center-based services. So these are awesome. We opened doors August 2018. We became the first Dakota Head Start in the state of Minnesota, serving 82 children and families, including expectant families. We're trauma-informed care, and we believe that our language can help us heal from historical trauma. So we have those wraparound services, and we know that data that's with our American Indian students, specifically our Dakota students. The data is there with the high percentage of NAS, FAS. The data is there with children being screened in our following school districts, and most of them that are screened for IEP, IFSP end up being Native American. So the need is there, and our wait list is there. So with this statute language changes, it ensures our funding is there, and with the statute language changes, it ensures the flexibility of usage of funds to be able to serve our Wakayaja, our sacred beings, we call our children, the way we know works, and the way we know that can help us grow, so then we can help our children grow, such as adding a bus, or right now I can't expand my building because I don't have the funding to, because I'd love to serve more because we have so many children on our wait list. With that, I think I'm about time. So Pidama Yapi, thank you everybody, and have a great day. Dokstake.
Thank you. You are perfectly on time. Thanks very much for your testimony. All right, and finally, from public testifiers, we have Amy Wallstein, Education Policy and Workforce Development Director, Minnesota Business Partnership.
Thank you, Madam Chair and members, and thank you for the opportunity to testify on House File 4228 today. My name is Amy Wallstein. I'm the Education Policy and Workforce Development Director for the Minnesota Business Partnership. First, we are pleased to see the Grow Your Own program to develop the early childhood educator included. This is a great step for strengthening the early care workforce. We're also very glad to see early learning scholarships included in this bill. I testified at the joint hearing in February about scholarships, and I'll just reiterate that this is an important program because scholarships meet all of the research-based principles for addressing opportunity and achievement gaps before they grow intractable. We're also supportive of the proposal to expand scholarship eligibility to ages 0 to 5 and to add children with incarcerated parents as a priority group. We also appreciate the administration's proposal to repeal language that enables pathway to scholarships. Where we have concerns with the bill is on the deprioritization of 4-year-olds for scholarships. This is unnecessary and detrimental to the choice and flexibility of the scholarship model. Families should have the full range of options for quality programs and not be penalized for making the choice to begin early education at age 4. Finally, I have a couple comments on the pre-K section of the bill. We want to acknowledge the improvements that have been made from the universal pre-K iterations brought forward previously. That said, the scholarship model would be a far better strategy to serve these children because it provides families with maximum choice and flexibility. The scholarship model also gives a fair chance of participating in the system to providers because scholarships follow children to any rated program. By contrast, the proposed pre-K model would subject providers to new requirements, another regulatory system, and another billing system. Imagine being a rated family child care provider already serving children on CCAP and scholarships, dealing with 2 sets of requirements and billing systems, and then entering into an MOU with the school district and needing to comply with additional requirements and another billing structure on top. We need to streamline the systems and not add more layers. Bottom line, scholarships are a proven model that have bipartisan support. So let's make 2022 the year we help the 31,000 low-income children under age 5 still waiting for a scholarship. Thank you.
All right. Thank you, Ms. Wallstein. All right. So we are through our public testimony. And at this point, it's time for member questions. And I will turn it over to Chair Pinto for his comments.
Well, thank you, Madam Chair. And actually, I'll have a couple of questions even as the bill author, because of course the bill came from the department. But what I wanted to do first was just to give the commissioner, if she'd like, an opportunity to respond. I really appreciated what Ms. Wallstein had to say and the observation, and I thought I wanted to give the commissioner a chance to provide her perspective on the comments made by Ms. Wallstein as we're trying to understand the proposal and et cetera.
All right. Thank you, Chair Pinto. I will turn to you, Commissioner Mueller.
Thank you, Vice Chair Pryor and Chair Pinto. And I do have my colleague on, Bobby Burnham, who is Assistant Commissioner who oversees the Office of Teaching and Learning and can also help to jump in here as well. So I appreciate her joining. And we do understand Ms. Wallstein's concerns and have really thought about how it is that we would be able to not only provide support for 4-year-olds, but also to help to provide support for 3-year-olds. And so it really is looking at being able to expand the number of students who are being served at the age of 4 and gives us the opportunity to look at what those scholarships would look like, as well as offering like a VPK type of program. And so it really allows us to really delve deeply into both and does not limit scholarships. I'll let Assistant Commissioner Burnham talk a little bit more about that.
Thank you. And so I will turn then to the Assistant Commissioner Burnham.
Thank you, Vice Chair and Representative or Chair Pinto and Commissioner. I think it's a really important point, and I think the fact that we are being as intentional as we are with the creation and expansion of our mixed delivery system, the mixed delivery system will provide choice, and we are hoping at some point the federal government will support expansion of pre-K. So we are modeling many components of this program from the Build Back Better, knowing that that may or may not pass someday, but it also is about high quality and the insurance of the components that we put in this pre-K program are of high quality. And through the mixed delivery system, a family will have a choice of choosing a center-based model, licensed family model, Head Start, or school-based. So the choice component is still there in this public pre-K program.
All right, thank you, Assistant Commissioner Burnham. And I will return the floor to you, Chair Pinto.
Thank you, Madam Chair. And I guess I also just wanted to have the folks from Department of Education clarify the language in the bill says voluntary public pre-kindergarten, and just recognizing that language does encompass that mixed delivery system that Commissioner Burnham was describing. I see Commissioner Mueller nodding. And so just sort of for our own understanding as committee members, that phrasing encompasses the mixed delivery system, including I guess the public part references public support, which we've heard in the committee is so important. But as far as the delivery of it, a significant portion then would be through private providers. And so just want to make sure we clarify that. And Madam Chair, I don't know if there's other particular questions that folks have about the bill. I'm just looking to see if I have anything in particular. I probably have a few small details, but I can ask that separately. I guess while I'm thinking of it, I wanted to encourage, I heard Ms. Osthoff, who testified, said that there were a few logistics that she was talking through with the department. And I just want to encourage her and anyone, please, that if you have thoughts regarding this set of proposals, especially regarding the bill language, please let our committee members know, because we are moving into making decisions about this proposal and others. And that'll be happening pretty quickly. And so we certainly would encourage you all to please be in touch with us, but any thoughts you have. And I see Madam Chair, Representative Jurgens has his hand up.
All right, Representative Jurgens.
Thank you, Madam Chair. And excuse me, Chair Pinto, I'm looking through the bill and there's a lot of different appropriations and I could add this up myself, but what is the total appropriation in this supplemental budget bill for 22, 23, and in the tails if there is?
Madam Chair, and I guess I would direct that to Ms. Beckel from House Fiscal Staff if she hopefully she can give us some insight in that.
All right. So we have fiscal staff, Ms. Beckel. Are you able to?
Thank you, Madam Chair.
There we are. Thank you.
Sorry, just one moment while I pull up that spreadsheet. It's important to keep in mind it's important to keep in mind with this that the pre-K funding is still being carried in the K through 12 area. So the governor's recommended changes for early childhood just include the early childhood and family education increase, the early learning scholarships increase, the early childhood family education teacher licensing support, the infant and early child mental health consultation, and then mental health services and early childhood social workers. And so the total cost that the governor recommends in fiscal year 23 is $82.491 million for this target. And then in fiscal years 24 and 25, the total is $166.59 million.
Madam Chair,
Yes.
if I may.
Mr.
Thank you.
Chair
So, because I did want to make sure, because Representative Jurgens, it is, as Ms. Beckel said, it is somewhat confusing because the bill includes all the programs within our jurisdiction, which do include pre-K. However, the funding for a portion of those goes through the formula, which is under the jurisdiction of the Education Finance Committee. And so, and then there are the rest of the public pre-K program, although it doesn't fall under the formula, it still all travels together, and I would expect that it would. So I think what Ms. Beckel was providing were the costs of the portions other than the public pre-K portion. So that part gets somewhat confusing. And I think Ms. Beckel, I see you nodding, so I think I'm describing that correctly. So just so you understand that.
Okay. Representative Jurgens.
So regardless of whose bucket of money this comes out of, and I understand that gets confusing, and there's, we have targets for different committees and so forth, and we don't have those target numbers yet, I'm assuming, unless you know something that we don't know, Chair Pinto. But I guess just total spending is more than 82.491 million in 23 and 166.59 in the other 2 years. But what's the total spending, regardless of whose budget it's going to hit? I'm just kind of curious what, we passed the budget last year, and this is supplemental. And I'm just kind of curious what additional spending we're looking at total to the state of Minnesota, regardless of which bucket of money or target that it's impacting.
All right, Chair Pinto.
And well, and Madam Chair, it may be Ms. Beckel has that information now as well. I'm not sure if she does. I know it's been somewhat of a struggle, Representative Jurgens, even over these last couple of days. We've been looking at this to sort of understand. I know Ms. Beckel is new in our area, is a very confusing area too. But I guess we'll see if she can provide any further insight about the cost of the public pre-K, about those portions that won't be traveling through our budget.
All right, and Ms. Beckel. Back to you. We'll see. We'll give you another shot at it.
Thank you, Madam Chair and Representative Jurgens. So to be clear, though, you are asking for only the costs shown in this bill, though they're not all carried in this area.
So
Yeah,
Representative Jurgens, you're looking for this entire bill. So the cost that we've just described, and that is actually under the purview of this committee this morning. You'd like to know, you'd like to know in addition to that, what the other costs are that will be talked about in the K-12 Finance Committee. The two of them together, all added together.
That's correct,
Yeah.
Madam Chair.
Okay.
Thank you.
And Ms. Beckel, are you able to answer that question this morning?
Thank you, Madam Chair. I apologize. Yes, so the items that are being discussed this morning, but are not fully included in the early childhood budget would be the total for fiscal year 23 would be 237.491 million. For fiscal year 20, and then for the tails, 536.59 million. I can also provide the numbers broken out per year if you'd like. Also, I believe that a spreadsheet is available that does show both of these items.
And Representative Jurgens.
That's helpful. Thank you, Ms. Beckel. I appreciate the information. And thank you, Madam Chair, for indulging my questions.
All right. And, at this point, would the department like to provide any more clarification on what we're discussing this morning? Or are we good right now?
Madam
Ms.
Vice
Bruno.
Chair, I have one quick comment just regarding the financing mechanism. We are designing this mixed delivery to partner with Head Start, and especially around the center-based and licensed childcare to be very similar to how the Pathway to Scholarship financial system works. So it won't be a new and burdensome system for childcare providers who participate in this program to manipulate. It'll be very similar to how we currently run Pathway 2s. Thank you.
Thank you, Ms. Burnham. All right. At this point, we're looking for other member questions and comment, and it looks like Chair Pinto, you might have.
No, Madam Chair, no, I think we probably need to move on to the next set of proposals. But I'll just note for you and for members that there's obviously a lot of detail here, and really want to encourage again members of the public and others to contact us with thoughts, and members, please dive in and let's continue to work this through. But I'm so grateful to the department for this set of exciting proposals, and we'll keep on working through them.
All right. Thank you, Chair Pinto. So with that, I lay House File 4228 over for possible inclusion in a committee omnibus bill. All right, and now we are moving on to the next set of proposals. We will now hear House File 4569 informationally. And Chair Pinto, would you please explain your bill?
Yeah, thank you, Madam Chair. And I want to note for members and members of the public, the reason this is informational is simply that the language, we received the language pretty late in the game. And so the PDF of the language was posted the other day. So the language has been out for at least a couple of days now, but the bill itself was not able to be introduced until yesterday. And we felt like that was just too tight to have that be an official hearing. But I should note it's for all intents and purposes the same thing as hearing it, laying it over. We're simply examining the language, and then we'll be able to go on from there. And again, I'm really grateful to the Department of Human Services in this case for their work in pulling this together. I'll maybe just note one other thing in case I forget. There was a comment about a spreadsheet with the different dollar amounts. Representative Jurgens had asked about that. I sort of had thought that we had such a thing available and posted, but if we don't, then I know that our fiscal staff is pulling that together to help members understand that. We'll be in touch to get that out to members. And so with that, though, Madam Chair, I'll simply turn things over to Commissioner Brown.
All right. So our first testifier this morning is Tiki Brown, Assistant Commissioner of Children and Family Services, Minnesota Department of Human Services. Ms. Brown.
Thank you, Madam Vice Chair, Chair Pinto, and committee members. My name is Tiki Brown, and I'm the Assistant Commissioner for Children and Family Services at the Department of Human Services. I'll be presenting on the governor's recommendations related to childcare. And we do have a slideshow. Excellent. Okay. So slide 2, we'll jump right in regarding the Child Care Assistance Program. So we recommend increasing the Child Care Assistance Program, or CCAP, rates to the 75th percentile of the 2021 market survey, which would be effective October 3rd of 2022. This is a federally recommended benchmark to ensure that equal access for childcare occurs for low-income families. The next rate would occur January 1st of 2025 and be updated automatically with each market rate survey, which occurs every 3 years. CCAP serves about 15,000 families and 30,000 children per month. And by increasing the rates, this improves access to affordable childcare for low-income families. It reduces out-of-pocket expenses and supports childcare providers with higher reimbursements. You can see the investments on the screen, as well as a 0.5 FTE, which would help support the hiring of licensing staff for our Office of Inspector General in anticipation of more childcare providers starting and renewing licensing. I'll also note that this proposal leverages $75 million of in childcare and development fund dollars in fiscal year 23. And for reference, this should all be around Section 26, Section 16, and Section 25. Next slide, please. Forecasting basic sliding fee program, we're recommending into a forecasted program. This would allow families to meet the income and eligibility requirements criteria to access a program starting in fiscal year 2024. Forecasting the basic sliding fee child care assistance program would ensure that families would not have to wait until funds are available to access the program. And with this change, it would eliminate waiting lists. When fully implemented, we expect around 16,000 families would be served by this program. And as you can see you can see the investment dollars located on there as well on the slide. And we also include some FTEs, again, to support the hiring of licensing staff in anticipation of more childcare providers starting and renewing licenses. This proposal does leverage $47 million in fiscal year 24 and 25. That will be transferred from the Temporary Assistance for Needy Families, or TANF block grant, to the Child Care and Development Fund. Next slide, please. The governor's budget includes a proposal to alter the definition of family under the Child Care Assistance Program, or CCAP. It includes foster care families, relative custodians, successor custodians, and guardians. This proposal would allow these individuals to access Child Care Assistance Basic Sliding Fee Program and receive increased financial support for childcare. We expect 2,000 families would be eligible for the basic sliding fee childcare as a result of the expansion. This proposal includes investments of $56,000 in fiscal year 23 and $37.4 million in fiscal years 24 and 25. For reference, Section 1, Section 2, and Section 3 are noted in the bill. Next slide, please. The governor's budget includes an additional $31.7 million in fiscal years 23 and $71.3 million in fiscal years 24 and 25 to support childcare providers experiencing financial hardship due to the COVID-19 pandemic and for other childcare provider supports. This section begins on line 20.8 in the bill. The proposal would extend the availability of additional resources and additional financial support for childcare providers after the federal funds that were made available in the American Rescue Plan, or ARP, are exhausted. Specifically, this recommendation includes $31.4 million in fiscal year 23 and $66 million in fiscal year 24 in flexible funds for programs experiencing financial instability. These funds will be available until fully expended or the end of fiscal year 25. And as you'll note, this was informed by the Family Child Care Task Force. And finally, this recommendation, our next recommendation is around building childcare capacity. We're looking to strengthen the childcare sector in Minnesota by extending the number of ARPA funding programs currently that are set to expire. Supports for the childcare program would include $1.9 million in fiscal year 25 to extend the one-stop childcare assistance network through the end of the 24-25 biennium. This network was established in the 2021 legislative session to support the startup of new childcare programs and to expand and sustain existing childcare programs. It includes $1.3 million in fiscal year 2025 to extend the workforce development grants through the end of 24-25 biennium. And again, these funds were also established during the 2021 legislative session to provide childcare training, job skills, and job placement for economically disadvantaged individuals and to increase the number of qualified early educators. It includes $500,000 annually in fiscal years 24 and 25 for shared services alliances, which were established during the 2021 legislative session to help family childcare providers achieve economies of scale and run more efficient programs, boosting provider wages, increasing enrollment, and leveraging shared support services to improve quality. And finally, $300,000 annually in fiscal years 23, 24, and 25 for grants or other supports to childcare providers to improve their access to computers, the internet, and subscriptions to online childcare management applications that could be used to help them improve their business practices. Madam Vice Chair and Mr. Chair, that brings me to the end of my presentation, and my staff and I will stand for any questions that the committee members might have.
All right, thank you, Assistant Commissioner Brown. Next, we will go to Cindy Yang, Director of Child Care Services, Minnesota Department of Human Services. Ms. Yang.
Hi, good morning. Cindy Yang, Director of Child Care Services. I actually do not have additional slides to share as Assistant Commissioner Tiki Brown has presented those already. Thank you.
All right. Then I assume you're standing ready for questions. All right, Chair Pinto, I'll turn it to you.
Yep. Good. Thank you, Madam Chair. And I was just going to ask, since we going to ask Ms. Mock perhaps to walk through just the sections. I know Commissioner Brown referenced the sections in different orders, but I think it might be useful to just have the same walk through the bill as we got on the other proposal. Members may find that useful if we can.
All right. Thank you, Chair Pinto. Ms. Mock, would you please walk us through the bill at this point? Are you available to do that?
Yes, thank you, Madam Chair. Good morning, everyone. So I will start with section 1 of Article 1. So the first 3 sections of Article 1 are all make changes to definitions that have to do with changing the definition of family to include foster care families, relative custodians, and successor custodians or guardians to be included as part of the CCAP program. Section 4 makes a change to the definition of student parent, and this has to do with, there's a number of sections in this bill that have to do with making technical changes related to forecasting the basic sliding fee program, which is part of this bill. So sections 5 and 6 and also 7 are all related to those changes to technical changes related to forecasting the basic sliding fee program. Section 8 is also a related change, as is section 9 and section 10. You're going to get tired of me saying this, but sections 11 and 12 and 13, also 14 are also all changes related, technical changes related to forecasting the basic sliding fee program. Same as section 15. With section 16, we get something different, and this is where the maximum rates under the Child Care Assistance Program are increased to the 75th percentile of the most recent child care provider rate survey. Section 17 is the technical change. Section 18, this is language that requires child care resource and referral programs to do 2 things. One is to administer the Child Care One-Stop Regional Assistance Network, which provides assistance to child care providers and individuals who are interested in becoming providers. And then section 2 provides supports, or sorry, the second thing that the resource and referral programs are instructed to do is to provide supports that enable lower income individuals to obtain skills training and career counseling to begin careers in childcare. Section 19 is technical changes related to the basic sliding fee change. Section 20 is a new section that directs the commissioner to establish a grant program to enable family child care providers to implement shared services alliances. And this relates to something the legislature passed last year, a similar program, and this puts that program into statute. Section 21 directs the commissioner to provide grants to child care providers to help them improve access to technology like computers and the internet. Section 22 is also a technical change related to forecasting the basic sliding fee program. Section 23 directs the commissioner to allocate additional money for the basic sliding fee program for calendar year 2024 to counties and tribes to account for that change in the definition of family. I'm sorry, that was section 23, I apologize. So now I'm on to section 24. And this is where it's directing the Commissioner of Management and Budget to actually forecast the basic sliding fee program beginning with the February 2023 forecast. Section 25 directs the Commissioner to allocate additional money to the basic sliding fee program for calendar year 2023 to give to counties for the increased maximum rates. And then section 26 directs the commissioner to make a one-time allocation of $75 million in fiscal year 2023 from the Child Care and Development Fund for child care assistance rates to pay for that rate increase. And then section 27 repeals subdivisions that are made, technical changes related to the forecasting the basic sliding fee program. And then Article 2 has forecast adjustments, and Article 3 as various appropriations. And that is the bill.
Thank you, Ms. Mock. All right, so we've finished the formal presentation for this informational hearing for the bill. I'm going to go to you, Mr. Chair, for comments at this point, and then we're also looking for member questions.
Thank you, Madam Chair. Yeah, so a couple things. One is I wanted to note for members that we did receive a spreadsheet. I referenced this earlier from our House fiscal staff, but had a bit of confusion about posting it, and it sounds like there's some pieces that need to be cleaned up on that. And so as we have that, we'll post that, and members of the public as well to the committee page and get it out. I did want to clarify, and I think maybe this would be for, I'm not sure if this is Commissioner Brown or Director Yang, about the difference in the stabilization grant funding that the administration is proposing as opposed to the stabilization grant funding that has been going out so far. If you can just, because I found that a little bit confusing and thought that members might find that helpful to get that clarified as well. Hopefully my question is clear enough to one of them.
Mm-hmm. Assistant Commissioner Brown, would you like this question or refer it to another member of your staff?
Thank you, Madam Chair. Cindy Yang can speak to this. Thank you.
All right, Ms. Yang.
Good morning, Ms. Chair and Mr. Chair Pinto. Can I just ask for a clarifying question? Are you talking about the difference between the Child Care Stabilization Base Grant versus the Financial Hardship Grant?
Chair Pinto.
Thank you, Madam Chair. And yeah, Ms. Yang, just wanting to make sure that we're all clear, if you could just explain about what the administration is proposing going forward with respect to the stabilization grants, building off of what's happened so far with those grants. Thank you.
Ms. Yang.
Great, thank you for clarifying. So the governor's proposal is for the financial hardship. And so with the financial hardship, it is based on the provider being able to demonstrate that they are in a financial hardship. There are specific criteria for a financial hardship, and that is different from the monthly base grant program. So the Child Care Stabilization has the monthly base grant that all providers can apply for, but the governor's proposal is to add additional funding to the financial hardship, which is the criteria are different.
Chair Pinto.
Thank you, Madam Chair. And I think that's helpful. I'm trying to think of, otherwise I feel like we've gotten a good understanding of where things are. And I'm just really grateful to the commissioner and to her team. So Madam Chair, unless there are other questions from members, then I don't think there's anything else from me on this, but so much appreciated.
All right. Members, questions on this informational bill? All right. Seeing no further questions, thank you for the presentation this morning. Thanks for a chance of hearing the bill at this point in our work. And with that, I will hand the gavel back to Chair Pinto. Thank you.
Thank you, Madam Chair. And I see Representative Lillie on, and I'm so grateful to him for his flexibility. I think we were expecting him to be going a lot later in the hearing. And so, but I gather since you're on, that you're ready, and hopefully your testifiers are on too. And I assume that they are, Representative Lillie. So you're ready to proceed with your bill, I gather. We'll get you. Okay, guys, I see you nodding anyway. Good stuff. Representative Pryor, if you could please move that House File 3563 be brought before the committee.
So moved, Mr. Chair.
Thank you so much. And Representative Lillie, so glad to have you with us. And again, appreciate your flexibility on timing. And please dive on in and present your bill.
Thank you, Chair Pinto and committee members, and very much appreciate you hearing this morning. The House file that was moved by Vice Chair Pryor appropriates $2 million out of the COVID response money, the Federal American Rescue Recovery Fund, and this money would go to the Minnesota Children's Museum. Hopefully all of you are familiar with the Minnesota Children's Museum. It's just an amazing treasure we have in downtown St. Paul, and of course they were really hit hard with the impacts, and continue to be hit with the impacts of COVID and what that, the pandemic, what that did to them. And they did everything they could do with the situation. They had to let go of almost 50 of their staff. And I know there's a sheet that was sent out to members, and hopefully you've had an opportunity to peek at it. But so they greatly reduced programming. And then they were lucky to get a couple of these, the PPP loans that we've all heard about. And that kind of helped them, somewhat, otherwise they probably really would have been in even more dire of a situation. But this continues. And so, as everyone knows, the Children's Museum is, it's kids, and the kids couldn't be vaccinated. And so families were choosing to stay home, and it just kind of spiraled and kept going. And if you've had an opportunity to be at the Children's Museum, it's very hands-on. They're, whether that's parents with the kids or kids, kind of running around and exploring and discovering and learning. And I like to say even grandparents. So I have an opportunity to visit with them. But with the COVID going around, they were greatly impacted. Mr. Chair, if it's okay, I have someone that's with me today this morning. It's the vice president from the Children's Museum of Philanthropy. And I was just wondering if she could kind of give you an idea of what they've gone through, and just if that's all right, Mr. Chair, and just kind of hear the impacts and why the need is really quite real. One thing I want to throw out too is the Children's Museum, before we get too far, is, I kind of had an opportunity to work with them as legacy chair, but they also do a lot of work all over the state. So it is not a building in St. Paul, but they're quite a statewide treasure as well. So, Mr. Chair, if we could pass to our testimony, and we'd happily have some questions.
Absolutely. Thank you, Representative Lillie. And Ms. Goering, please, if you can identify yourself, and then please proceed with your testimony.
Yes, absolutely. Good morning. Thank you, Chair Pinto and members of the committee for this opportunity to speak on behalf of House File 3563. My name is Bree Garink, and I am the Vice President of Philanthropy for Minnesota Children's Museum. I'd also like to share my gratitude with Representative Lillie for carrying the support of this bill. As a nonprofit organization that's relied heavily on admission-based revenue sources to operate, you can imagine how hard the museum's been hit by the pandemic. From the start of the pandemic through our current fiscal year 2022, our organization is facing a loss of revenue totaling $7 million. For context, our last pre-pandemic full fiscal year of attendance was 450,000 visitors, serving families from all 87 counties in Minnesota. Our last completed fiscal year ended with attendance of just 97,000. Our pre-pandemic earned income was 5.7 million, and our last fiscal year dropped to just 2.1 million. Facing insolvency, we took immediate actions and measures to ensure the museum's continued existence. This included eliminating 49 positions, which reduced our staffing by 1/3. Because of this, we've had to eliminate many impactful programs inside the museum, as well as greatly reducing our community outreach. Thanks to these measures and the 2 PPP loans, we have been able to survive and also have utilized fundraising as a way to mitigate through this financial crisis. We continue to operate as this reduced organization, yet unfortunately are still continuing to operate in deficits, which will be our reality until our audience does rebuild, which we estimate will take years as families are just making different decisions right now. We do not come to this ask of relief funds lightly. Unfortunately, our organization has fallen through the cracks, not being eligible for many of the relief fund opportunities that have been available for other businesses and organizations. We do seek this relief and support not only to remain viable as a statewide asset, but also to continue our important work as a leading provider of hands-on learning. Thank you again for your time, and also very happy to address any questions.
Thank you, Ms. Goering. Thanks for your really important work. The Children's Museum is just terrific. I know supports young kids from all throughout our community. So members, are there questions regarding this proposal? Looks like Representative Pryor, you may be raising your hand. Yep, Representative Pryor, please. And then we'll go to Representative Bennett. So Representative Pryor.
Thank you, Mr. Chair. And just to just to understand again the context, I think that was alluded to by Ms. Gurnick's testimony, is that it seems like we know that there's a lot of sectors that were hit really hard, and that we've tried to reach out and sustain them and get them back on their feet as we move away from the pandemic. So I'm thinking stages, that bill that was the federal one, and that we tried to do for performance venues. And so it seems like the museum is kind of in that category where it depends on in-person live attendance to sustain itself. Has there been federal funding that was proposed that would have included the museum? And is it anything else that still might come forward? Or pretty much this is it, just looking at the state and what we're able to do to just sustain this incredibly valuable resource. And I can testify that this is, we bought memberships in the past and continue to buy memberships even when we weren't going, because we just know how important this treasure is in Minnesota.
Ms. Goering, please. Yeah.
Yes, thank you, Madam Chair. So there, we are pursuing at the city level through the city of St. Paul. So there were some larger opportunities that fortunately many other organizations have been able to take advantage of. There were some eligibility put in place that didn't make us eligible. For example, Shuttered Venues Grant needed fixed seating to be eligible for that. And we are proudly don't have fixed seating as part of our organization, as it is hands-on and our smallest learners. So unfortunately, we just haven't been eligible for those larger relief funds.
Thank you. I see your hand is down, Representative Pryor, so we'll go to Representative Bennett.
Thank you, Mr. Chair. And actually, one of my questions just got answered. I was wondering what helps were not available to the Children's Museum that were available to other businesses. So thank you for that, answering that in advance. So I will ask my second question. And first I'll say, I think the Children's Museum is a wonderful experience for kids. It's a great asset for the children in our state. So thank you for that. And I'll just throw this question out to either Representative Lillie or whoever, but I'm just curious because I know there are other children's museums within the state and why they're maybe not included in this funding, or are they going to be asking separately, or are they not having issues? I'm curious about that.
Representative Lillie.
Thank you, Chair Pinto, and thank you, Representative Bennett, as a former teacher, and we very much appreciate the compliment to the Children's Museum. And but yes, other children's museums, there is an effort. Senator Rood and myself have a bill that is also being worked on that's quite a bit larger, and that's it may cover. It's intended to cover some of the cultural and different venues all over the state of Minnesota. So that's another additional effort that's working. But this one is primarily, or not primarily, is focused on the Children's Museum and trying to get them help that they need as well. So, but there is, it's a great question, and there is a need, in so many different areas. The cultural area, of course, has just been really impacted, with the, people just not being able to go out and attend shows or et cetera, et cetera, et cetera. So it's a great question. And so we're trying to get this on, this bill is addressing this, although they do a lot of programming statewide, but I know they're, the other bill kind of works on trying to get at some of the, broader issues as well.
Back to Representative Bennett.
Thank you, Mr. Chair. May I have a follow-up question?
Yes, please.
Oh, thank you, Mr. Chair. So another question I have, just to double check with this, that Representative Lillie, this funding comes out of the federal COVID relief fund, I believe. Is that correct? And I'm also curious what the balance is, if we know that, I'm assuming that's being held in Minnesota for expenditures or whatever, but what the balance is in that fund. This would take $2 million from it, I know. So would you have that information by chance?
Great question, Representative Bennett. I'm actually noticing that myself. So Representative Lillie, and I see Mr. Berg is unmuted and with us too, but Representative Lillie, I'll go to you and then you can direct it to Mr. Berg if you like, or.
Thank you, Mr. Chair and Representative Bennett. I would like to go to our star team. Boy, it's nice to see them. They used to be here right on this third floor. Now they're, but no, I think Mr. Berg would. And
yes, let's get Mr. Berg's expertise. Mr. Berg.
Mr. Chair, Representative Bennett, the number that's being used by the House for the balance of that was left by the last year's legislature for the American Rescue Plan funding is 1.15 billion.
Thank
and,
you.
Thank you, Representative Bennett. And I should note that was Doug Berg and House fiscal staff. I may ask Mr. Berg, or maybe Ms. Beckel knows this, and sorry, Representative Bennett, just for leaping in, but I just want to get this clarified for myself. That's obviously separate than whatever target to be set for the general fund. What sort of guidance is there regarding committees? Presumably our committee couldn't decide together, well, we're just going to, pass something to Ways and Means. Again, maybe we could to spend $1 billion. We'll see what Ways and Means would do with it. Sort of, how does that work as we would be thinking about an allocation coming out of this fund for our committee?
Mr. Chair, at this point, there is not any official guidance, and you will note that there are lots of bills that appropriate money out of those funds. I anticipate that there will be some kind of guidance for us as to who can spend this money on what, but right now there isn't any. It's just sitting there to be used.
Thank you, Mr. Berg. Yeah, and Representative Bennett, I'll send back to you, but it's a helpful. Thanks for kicking off this line of questions.
Yeah.
I'll admit my brain hadn't been thinking about that. But Representative Bennett.
Thank you, Mr. Chair, and thank you, Mr. Berg and Representative Lillie, for all the good information. And it would seem this would be totally good reason to spend those COVID dollars. And so thanks for bringing this bill, Representative Lillie.
Thank you, Representative Bennett. Representative Jurgens, you're up.
Thank you, Mr. Chair. Well, going third, all of my questions have been answered already. I specifically wanted to know about other programs that were available, the Shuttered Venues Operator Grant and Ms. Geerling touched on that, and Representative Lillie addressed the other 7 children's museums. So all my questions have been answered. I just want to offer my support to the Children's Museum. I remember taking my kids there, and a friend of mine, a little guy who's 12 now, when he was littler, we went there, and now I've got grandkids that we'll have to introduce to the Children's Museum perhaps this year. But so no questions. Thank you.
Thank you, Representative Jurgens. I am not seeing other questions. I'm going to give it to you in just a second, Representative Lillie, but I just want to note I have a cousin who did the Peace Corps in the Dominican Republic and married a Dominican man. They live in Santo Domingo, and their family came here a couple summers ago, and we brought the kids to, they have 4 kids, and we brought them to the Children's Museum. And her husband especially was amazed that that our society and that our country was investing and had a space specifically built for young kids and for their development and for their growth, and was just so impressed. And we had a blast there together. So I love being there. So anyway, just kind of a little personal plug. But Representative Lillie, you get the final word as the bill author, please.
Thank you, Mr. Chair, and thank you to all your members. You know, it really is a state treasure, and we're lucky that that the work they do. And I quickly grabbed the sheet. I was kind of, just to give an idea of, pre-COVID, they had 450,000 visitors, a year, and then 20,000 families, and a lot of them are, over 5,000 lower income families. 25% of the folks that come through the door are people of color, and so it's just kind of it's really neat, to a really healthy place, and it's it's actually fitting in your committee quite solidly, because to building a strong future for Minnesota. So anyways, thank you for your time this morning, and I know the museum's open for questions, and I certainly would be too, but thank you again for your time, sir.
Thank you so much, Representative Lillie. And I don't see any other member questions. So with that, the chair lays over House File 3563 for possible inclusion in a committee budget bill. And we'll sort out some of those fiscal questions a little bit to see how that works, but a really, really worthy investment. And thank you so much, Representative Lillie. And thanks to Ms. Geerling and the whole team at the Children's Museum. Thank you. So members, I want to just take a couple minutes before we wrap up to just kind of lay out where I expect things to go in the next couple of weeks before we go to our legislative break the second week of April. And so working backwards, I would expect that our committee would be voting out a budget proposal in the areas under our jurisdiction before that. And as we did last year, that cycle would be that I'd expect the first week of April to be unveiling a budget proposal for your consideration, walk through that, receive public testimony, consider amendments, and then eventually vote that out. So that'll be coming. I would expect that there may be pieces of that, there are likely to be pieces of that would need to go to, especially the committee chaired by Chair Davnie, Education Finance, because as you heard in the budget presentation today from MPE, there are pieces that are caught up in the funding formula that goes to schools. Assuming that there would be that the proposal would contain components of that. So sort of expect that may be coming as well. So I would expect that on Tuesday, our next hearing, we're going to hear a series of proposals. We have a number of bills to work our way through. We may well, as soon as Thursday, be considering some pieces of budget proposals. On Friday, you will have received a message about this, members, but I also announced this on Tuesday that I'm expecting we're going to have a joint hearing. Expecting to have a hearing on Friday, April 1st at 10:30. That's still tentative, but the expectation is that may well be a joint hearing with the Public Safety Committee. And so we've got a nice tradition in our committee of these joint hearings. So here's another one. And then moving on that following week. And I would expect there'll be, we'll put all that together. So members, are there questions that folks have about this at this point that you want to ask? And of course, we can be in touch separately as well. But in case you do, I want to give that chance. I am not seeing hands up. So again, really would encourage you to dive into especially the proposals we heard today and consider your own thoughts about directions we should be going. We are kind of on the fast track here to getting to spring break and then to moving on and not have regular committee meetings after that. But we still have some more work to do. So, okay, well, good. Well, thanks so much, members. You get a little bit of your morning back. With that, our meeting is adjourned. Thanks so much.